Mipomersen is antisense oligonucleotide that inhibits the production of apolipoprotein B. Apolipoprotein B is the central protein in the structure of several lipoproteins, as VLDLs, IDLs, and LDLs. We need apolipoprotein B for production and catabolism of very low-density lipoproteins and low-density lipoproteins. Without apolipoprotein B, these proteins cannot be even produced. Apolipoprotein B100 is synthesized in the liver tissue, and it's liver tissue that produces lipoprotein particles. The major type of lipoproteins that carries cholesterol are low-density lipoproteins, and due to this reason we consider them as the major risk factors for atherosclerosis and thereby for coronary artery disease. So because LDLs cause atherosclerosis, and at the same time LDLs cannot exist without ApoB100, by targeting of ApoB100 we can prevent atherosclerosis. Nowadays, most lipid-lowering medications reduce lipoprotein's concentration by stimulating the degradation of these particles. But more efficient approach is to control the production of lipoproteins, and one of the possibilities is to reduce the production of ApoB100, because without this apolipoprotein, lipoprotein particles as VLDL and LDL cannot exist. Mipomersen is a second-generation antisense oligonucleotide, which targets the production of apolipoprotein B100. Decrease in production of apolipoprotein B100 causes decrease in production of all lipoprotein particles that contain ApoB100. Mipomersen is antisense oligonucleotide, which means that this drug alters the structure of matrix RNA molecule that encodes ApoB100. After the injection, mipomersen transported to the liver tissue, where by binding to matrix RNA molecule, mipomersen prevents the production of ApoB100 protein. This causes decrease in production of atherogenic lipids and lipoproteins as VLDL and LDL. But there is one problem. Mipomersen may cause hepatic steatosis due to the accumulation of fatty acids in the liver tissue. So let's explain all these features of mipomersen. So on chromosome 9 located gene that encodes ApoB100. Genetic information is encoded in DNA molecule, and DNA molecule is a number of nucleotides. Recall that DNA molecule consists of two strands, its coding strand and non-coding strand. And to use this information in the gene, information must be carried to ribosomes where proteins are made. So DNA molecule, for this purpose, makes a copy of that gene in form of matrix RNA molecule. This process called transcription. And transcription results in production of matrix RNA molecule. Matrix RNA molecule goes to ribosomes. Ribosomes read nucleotide sequence in matrix RNA molecule in codons and include complementary to that codon amino acid. In this case, it's valine and glycine. And a particular amount of amino acids form protein. In our case, this protein is ApoB100. Then liver takes ApoB100, adds some amount of proteins. Also liver adds cholesterol molecules and triacylglycerols molecules, and altogether proteins, cholesterol, triacylglycerols, and ApoB100 form very low-density lipoprotein particles. This entire process takes place in the liver tissue. After VLDL particles are formed, liver secretes them into the blood. In the blood, VLDL particles deliver fats to peripheral tissues. Mostly, VLDL particles deliver fatty acids. What is left after the delivery, and as we can see, mostly it's cholesterol, we call low-density lipoprotein particles. LDLs have two pathways. First of all, if LDL particles encounter the LDL receptor on liver tissue, they do not think twice. LDL particles bind to this receptor and LDL receptor uptakes these particles into the liver tissue. This pathway is the best possible scenario. The second pathway is the bad scenario. Some amount of LDL particles in the blood undergo oxidation, and such oxidized LDL particles will be uptaken by the macrophages that are located in the blood vessels. And when macrophages uptake LDL particles, the content of LDL particles begin to deposit within the blood vessel wall, and with time, progressive accumulation of cholesterol leads to atherosclerosis. Once mipomersen comes to the liver tissue, mipomersen binds to matrix RNA molecule, and with binding, mipomersen changes the nucleotide sequence. So, binding of mipomersen to matrix RNA molecule results in production of altered matrix RNA molecule, and we have a specific enzyme that checks the state of matrix RNA molecule. This enzyme is called ribonuclease. Once mipomersen changes the structure of matrix RNA molecule, ribonuclease recognizes such altered matrix RNA molecule as something pathological. Usually, pathological means dangerous, and we do not like anything dangerous. So because of this, ribonuclease uptakes and destroys such altered matrix RNA molecule. Now, we do not have matrix RNA molecule that encodes ApoB100 protein, and without matrix RNA molecule, ribosomes won't be able to bind amino acids. Without amino acids, we cannot make a protein. So now, we cannot produce ApoB100. Without ApoB100, we cannot produce very low density lipoproteins. So the concentration of VLDL particles in the blood decreases. With decrease in VLDL production, the formation of LDL particles decreases, simply because LDL particles are formed from VLDL particles. And the lower the amount of LDL particles in the blood, the lower is the chance that some of them will be uptaken by the macrophages to the blood vessel wall, and thereby the lower is the risk of atherosclerosis. So, mipomersen causes decrease in LDL concentration in the blood, which results in decrease in blood cholesterol level. Also, mipomersen causes decrease in VLDL concentration, which results in decrease in triglycerols level. But there is one significant problem. As we can see, with decrease in VLDL production, we cannot transfer cholesterol and triglycerols from the liver tissue. As a result, both cholesterol and triglycerols begin to progressively accumulate in the liver tissue. And accumulation of lipids lead to hepatic steatosis. With time, hepatic steatosis causes liver injury, and one of the hallmarks of the liver injury is elevation of ALT. So, by disruption of ApoB100 production, mipomersen causes dose-dependent reduction of LDL, cholesterol, VLDL, and triglycerols. Nowadays, we know that mipomersen can reduce LDL cholesterol by 30 to 47%, which is significant. VLDL lipoproteins can be reduced by 20 to 35%, and triglycerols can be reduced by 10 to 20%. Here we can see the effectiveness of mipomersen in different groups of patients. As we can see, in all of them, mipomersen causes reduction of LDL cholesterol, reduction of ApoB100, VLDLs, triglycerols, and even elevation of high-density lipoprotein particles. Mipomersen has two major side effects. First of all, mipomersen can cause injection site reactions. But the more dangerous side effect is liver injury that manifests with elevation of ALT. And we know that elevation of ALT is caused by accumulation of fats within the liver tissue due to the inhibition of ApoB100 production. But with discontinuation of mipomersen, aminotransferases returns to normal.